Comment your name and state below. I'd love to see who's watching and benefiting from these videos. So, let me start with something surprising today, because this isn't a topic you're going to hear from many agents, and honestly, even a lot of Medicare experts haven't fully wrapped their heads around it yet. While everyone is talking about the 2026 cuts, reduced grocery allowances, transportation disappearing, dental being scaled back, prior authorizations tightening, there's something unusual happening quietly in the background. And that is a tiny number of Medicare Advantage plans doing the opposite. Instead of taking benefits away, they're adding something big, something that most seniors have been begging for years: actual home care support. Now, before we even get into the details, let me make this clear: this is still rare. Very rare. Like, you might need binoculars to find these plans rare. But they exist. And for the people who qualify, they are real. And they can be life-changing. That's why I wanted to break this down for you today in a simple, calm, and straightforward way, so that by the time you're done watching, you know exactly what's happening, why it's happening, and what it means for you going into 2026. I was helping a lady 2 weeks ago. Her name was Patricia, from Florida. She's 73, lives alone, and she told me something that stuck with me. She said, "I don't need someone to live with me. I don't need a nurse. I just need someone to help me with the little things." She meant basic home activities: sweeping the floor, organizing medications, helping carry groceries from her car up the stairs. Things that don't feel like medical needs to the insurance company but feel like mountains when you're dealing with arthritis, or recovering from surgery, or just trying to stay independent. Most Medicare Advantage plans don't help with that. They'll tell you they cover home health, but that usually means skilled home health, which is temporary, doctor-ordered, and very limited. It's not the kind of home support people imagine when they think of someone assisting with day-to-day life. But 2026 is quietly bringing a new trend: a handful of plans adding personal home care hours. Not skilled nursing. Not physical therapy. But real, hands-on help at home. Before you get too excited, because I know this sounds like the "finally, they're listening" moment, let me be completely honest. These plans are not everywhere. They are not in every county. And they usually come with eligibility rules. But they're real enough to make companies pay attention. They're real enough to start showing up in the filings. And they're real enough that I think they could spark a bigger trend over the next few years. Let me give you a real example, without naming the exact plan, just to keep it fair. One of the plans I reviewed for 2026 included 8 hours per month of in-home personal care for members with chronic conditions. That means things like help with meal prep, laundry, light cleaning, or running small errands. Not unlimited, but enough to take pressure off seniors who are struggling. Another plan, in the Midwest, included something even more surprising: optional caregiver support hours. Meaning, if the member had a family caregiver, a daughter, a spouse, whoever, the caregiver could receive a small number of respite hours so they could take a break while a trained helper stepped in. That's rare. I haven't seen that in years. But it made it into the filings. Now, does this mean Medicare Advantage is suddenly turning into long-term care? No. Not even close. Long-term care is expensive, like astronomically expensive. And Medicare Advantage plans operate on fixed budgets. They can't suddenly start offering unlimited home helpers to everyone. But what they can do, and what a few of them are now doing, is offer small, targeted support for people who qualify based on chronic conditions or functional limitations. Think about the direction healthcare has been moving. Medicare doesn't want people going to nursing homes unless they truly need to. They want you to stay home longer. They want to reduce hospital readmissions. And they want to avoid expensive complications. So adding a few hours of home care? Believe it or not, that's cheaper for them than paying for hospital visits that happen because a senior slipped while trying to clean their own bathtub or carry laundry down the stairs. It's not kindness, it's cost management. But you know what? Sometimes cost management leads to good things. I had another viewer from Texas, his name was Raymond. He's a 68-year-old veteran with COPD who called me almost in disbelief when he saw his 2026 plan updates. He said, "My plan is actually adding home care? Is this even real?" I had to double-check it myself. And yes, his chronic condition made him eligible under their supplemental benefits for chronically ill members category. It wasn't huge. It wasn't unlimited. But it was real. And he told me, "I'm not embarrassed to say this helps me more than dental, more than vision, more than the OTC card." That made me pause. Because I realized something most people don't talk about: transportation and grocery allowances are nice. Dental is important. OTC is helpful. But for many people, the thing they need most is help in the place where they spend 95% of their time, at home. The place where independence is either protected or slowly slips away. And yet, these benefits are so rare that most people will never even hear about them. They're buried in the last few pages of the evidence of coverage. They're only offered in a few counties. And they often come with qualifiers like only for members with qualifying chronic conditions or must meet functional assessment criteria. So let's talk about 2026 specifically. Why are these benefits popping up now, when everything else seems to be getting cut? This is where the story gets interesting. Over the last few years, CMS, Centers for Medicare and Medicaid Services, has been encouraging plans to offer what they call special supplemental benefits for the chronically ill, or SSBCI. These benefits let plans offer things that normally wouldn't be allowed under Medicare rules, things like grocery support, pest control, transportation for non-medical reasons, and yes, home care. But here's the twist: to offer these, a plan has to be financially stable enough to support them. That's why so many companies in 2026 are cutting back on the popular stuff like groceries and transportation, because their budgets are tightening. So the plans that are adding home care are essentially sending a message. We are stable enough to invest in benefits long-term. Or, we are targeting a very specific, medically needy audience. It's not generosity. It's strategy. Home care hours are not given to everyone. They're part of a subset of benefits aimed at high-risk members, the people who cost the system the most when things go wrong. And helping those members stay stable is actually cheaper for the insurance company. So these home care benefits are not just perks, they're investments. But what does that mean for you as someone watching this video? It means you can't assume your plan has this. You can't assume your county has this. And you can't assume you qualify even if your plan offers it. What you can do is check. Because even if it's rare, it's real. And even if it helps only a small number of people, for those people it can be the difference between independence and a nursing home. If your mom struggles to clean her kitchen because of her arthritis, this matters. If your dad is diabetic and has mobility issues, this matters. If you live alone and worry about doing certain things safely, this matters. These benefits are small but meaningful. Another viewer from Nevada told me something powerful. She said her biggest fear wasn't losing her OTC card or losing her dental coverage. It was losing her ability to live alone. She said, "Every year I feel like the system is trying to push me into a nursing facility sooner and sooner." When she found out one of the new plans in her area offered a few hours of home support each month, she cried. Not because it was a huge amount of help, but because it meant someone finally recognized the real struggle that seniors face. I want to make something very clear: if you don't have a chronic condition that meets the criteria, these benefits won't apply to you. They are not general perks. They are targeted. They are conditional. They are limited. But for the people who do qualify, this is one of the few Medicare Advantage benefit categories in 2026 that is actually expanding. You might be wondering, is this the start of a bigger trend? I honestly think it could be. Not in 2026, that's still too early. But by 2027, 2028, and beyond, I think more companies will follow this path if Medicare Advantage continues shifting toward keeping people at home longer. The entire healthcare system is moving toward home-based care, remote monitoring, telehealth, at-home rehab, virtual visits, and more. It only makes sense that personal home support will eventually follow. If you want to know whether your plan is offering this, here's the simplest thing you can do. Look for the words, supplemental benefits for the chronically ill, in your 2026 summary of benefits or evidence of coverage. Or just call the number on the back of your card and ask, does my plan offer any in-home personal care hours for qualifying chronic conditions? Not home health. Not skilled nursing. Personal care hours. Those exact words. I know this video went deep. But this is an important conversation. Because home care is one of the biggest gaps in Medicare. And while most plans aren't filling that gap, a few are starting to. Quietly. Carefully. Strategically. And for the people lucky enough to qualify, this could make life safer, easier, and more independent in 2026. If you want more videos breaking down these hidden benefits, or you want me to review more rare 2026 editions, let me know. And like I always say at the end of these videos, comment your name and state below. I'd love to see who's watching and benefiting from these videos.